Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Laboratorial news. This audio podcast as part of a LabZtorm. This audio podcast as part of a crowd broader. This audio podcast as part of a Storm Robotics production. In this audio podcast, an overview in regard to the healthcare laboratory. So the increase in demand for healthcare has led to a year-on increase in the number of laboratory investigations and sort of the tests carried out by healthcare professionals such as healthcare scientists. In addition to fulfilling a National Health Service or NHS laboratory tests for healthcare service users in amongst the CKD population and others in amongst other long-standing or long-term conditions, healthcare and so thus healthcare scientists are also fulfilling the requests that are not always necessary or warranted in amongst primary care, i.e., for example, where there can be a potential over requesting, over requesting. So only healthcare scientists who are sort of perform laboratory investigations can provide scientific can sort of provide specific education and guidance regarding laboratory trends and parameters when to screen healthcare service users for specific diseases and prompt a laboratory reference range for sort of treatments and or sort of referral. Thus the shift the shift thus shift the shift and thus shift the sort of sort of shift sort of the sort of shift aspects of workings between between uh, between healthcare sectors, but also in line to prompting more sort of efficiency across sort of practices in aligned to the National Health Service again, for example. So terminology at the same technology or technology has also enabled a range of point of care testing or POCT or NPT near patient testing and diagnostic kits to be more accessible to healthcare service users, thereby improving screening and compliance. But for CKD for CKD healthcare service users, understanding the disease pathways and the test investigation results and the relevance is still or can still be a challenge. The understanding by sort of an array of healthcare professionals, healthcare service providers relating or regarding to laboratory tests and investigations sort of adds to this complexity. Patients or healthcare service users see several members of the multidisciplinary team or MDT at varying times and can receive misinterpreted results. Information tech and the exchange of laboratory results through electronic patient records or EPRs has led and enabled healthcare service providers to share aspect or to share the care of healthcare service delivery and provision. There are still and can still be missed opportunities amongst primary care to support best practices for those in amongst the CKD population. The main drivers, for change to sort of pathology, to pathology and laboratory medicine services, sort of include the following. So number one, a greater need for healthcare service, focused services. Number two, the requirement to embrace sort of competitiveness and plurality of provision. Number three, a requirement to reprofile the workforce to make it better suited to new tech and modern ways of working. Number four, the need for the definition of core data to create a sort of framework to measure efficiency and effectiveness. Number five, a recognition of the status of a core clinical service in relation and regard to impact on healthcare service journey, leading to a requirement for laboratory services to be commissioned and delivered as part of an integrated healthcare system. And number six, the need for good leadership. That draws this audio podcast to a close. This audio podcast as part of a Laboratorial news. This audio podcast as part of a Hella LabZtorm. This audio podcast as part of a Crow Brother. This audio podcast as part of a Storm Robotics production.